Be advised, if the opinions and views of the hosts and guests do not reflect those of the station.
Good evening, ladies and gentlemen. Welcome to Philippines Uncut. I'm your host, Buddy Cunanan. Now, on this show, we talk about everything under the sun, and tonight's topic is about health and wellness. Now, you know, folks, here in Philippines Uncut, we have made the anti-cancer campaign an advocacy of sorts. You can call it a crusade, as we seek to increase awareness to as many people as possible about this dreaded illness, the possible causes, and possible remedies, focusing, of course, on alternative methods. Now, where Western conventional medical science has failed, or seems to have failed, we hope to bridge this gap through our discussions on alternative treatments. Now, last month, we featured Dr. Benavidio Castro and his Dorn method, his gentle spinal manipulation, and his practice of helping a lot of people with cancer. Today, our discussion continues on alternative remedies, and our guest tonight is Mr. Dr. Ernest Francis G. Nora. And he is a psychiatrist, an MD, and an integrative medicine specialist. And joining him is, again, an alumni of Philippines Uncut many times over, Hans Palacios, natural health advocate. Welcome, gentlemen, to Philippines Uncut. Good evening.
Good evening.
Thank you very much for coming on the show. Now, Hans, let's start with you briefly. Tell the viewers about your work as a natural health advocate.
Yes, I'd like to basically spread the news about what the natural health industry has to offer, as opposed to the pharmaceutical. So for years we've been it's been pounded on us that the only way to go if you're sick is to do it pharmaceutically, and to a certain degree it's not really that successful. However, nature always has its answers. Diet, the food that we eat, how busy we are, the exercise, removing all stress, and we're looking at that alternative. The lifestyle that we live dictates how well we're going to be, and that's what we're doing.
Excellent. Now, Dr. Nora, let's talk about your background. You are a active alternative medicine advocate and practitioner, but you're also an MD. You're trained as an MD, as a psychiatrist. Now, tell us a bit about your background. What led you from Western medicine to alternative medicine?
When I was a resident trainee in the National Center for Mental Health, we would usually be assigned in different hospitals. At the same time, we have to do research as part of our residency program. It was while doing these researches that I found all the ill effects, or what we call as the side effects of all the medicines. So one medicine would be treating one symptom, but would be producing other symptoms that would have to be treated by other medications, which would in turn produce other symptoms. So it's like a domino effect.
Okay.
Because of one illness and the medicines you take, dumami yung sakit. I was also doing volunteer work for the AIDS program in our DOH. And sad to say, we have no budget for AIDS. Our country right now, I think, is in the top 10 of the countries in the whole world that
Yes.
would have an increasing population of AIDS patients.
Absolutely.
It was there that since we have no budget, we started to treat these patients in the alternative way. We did acupuncture, music therapy, dance therapy, and true enough, all their blood counts improved. So that made me that opened my mind in this alternative form of medicine.
Yes. Interesting you should mention that the Philippines is among the countries with the highest AIDS rates or new AIDS cases, rates of new AIDS cases in the world. I remember reading an article a few months ago where they had one column on one side say with the countries where AIDS has actually decreased, with a lot of countries on one side, and on the other side there was actually a very small list of a handful of countries where AIDS is actually on the increase, and the Philippines is one of them.
We're in the top 10.
In the top 10, imagine that. Jeez. I hope this situation can be improved and AIDS can be cut down. And one of the ways is the RH bill. So I'll make a little pitch for that. Okay, so let's talk about your experience. So you actually saw how how medicines would contribute to making people more ill, or contribute to other illnesses that needed treatment as well.
Because medicines right now would really just try to suppress your symptoms.
Okay.
They would not really try to find the root cause. What's making you develop these symptoms is usually not addressed. So you need to take these medicines over and over again. That's why it's called maintenance now. Because they're not treating the person, they're suppressing the symptoms. What we do in natural medicine is we would like to go for the root cause. First, our advocacy really is we would like to make you healthy so that we could prevent illness even before it starts. But once there's already a problem, we would always try to go for the root cause. Treat you from the origin, what's making your body sick or weak, and that's what we strengthen.
Okay. Now, let's talk about, you are the medical director of the BioSafe Center for Complementary Medicine. First, let's define what complementary medicine is.
In complementary medicine, it's also called integrative medicine because we combine Western medicine, where I have been trained, and Eastern medicine. Because Western medicine, as Han said, right now has failed in chronic illnesses, hypertension, diabetes, the lifestyle disorder, cancer. But it's still good in surgery, infection, or trauma. But what the problem, majority of the problem right now is these chronic illnesses, cancer in particular.
Wow.
So Western medicine has failed there because it has focused on if there's a mass.
The symptoms.
The symptoms. Remove the mass, kill the cancer cells. But what caused the cells to mutate in the first place is not addressed. So we have recurrence of cancer left and right. So what we try to do is we always try to go for the root cause. What made your cells mutate, then that is what we address first. Then also strengthen the organs that have already been weakened and let the flow of energy or life flow naturally. Our body was really designed to heal itself. Life would always heal itself if sometimes you just let it.
Yes. Hans, what do you guys in the natural health advocacy have to say about what Dr. Nora said?
Yes, we agree with that because we find they, like us, we're always looking for a natural solution. Most of the cases of chronic illnesses starts from the immune system, and the weakening of the immune system has very different causes, starting from poisons or toxins in the body, emotion, stress, and all those factors. And then, of course, the environment where the person lives in. So, basically, you have to address all those factors that affect a person's health. So, we don't believe that nature hasn't provided a solution to all these things. Problem is that we have shied away too much from nature, what we should be attached to, rather than taking all these synthetic solutions that are being offered to us, all these non-natural medicines and all the technology that's very invasive and which don't really address the source, but rather the symptoms.
Okay, let's take off from there. Let's take off from there and talk about cancer. Your observation of cancer patients these days, Dr. Nora. Do you see cancer increasing or incidences of cancer increasing these days?
It's increasing in an alarming rate. When I was still a medical student, it is very rare. 1 into 80,000, 1 is to 100,000.
Wow.
Now you could see cancer in every family. At least one member would have cancer.
Yes, yes.
And what's really scary, sir, is that they say that by 2050, the rate would be 1 is to 400. At the end of the millennium, at the rate our environment is being destroyed, all of us would have cancers by then.
Wow. Okay. Let's talk about diagnosis of cancer and cancer treatment. Let's talk first about conventional methods, Western medical methods. Now, if someone is ill with cancer and goes to Western trained doctor, what is the first thing, or what would be the first recommendations of this doctor for this patient?
The problem with cancer is it usually goes undetected. It would only produce symptoms once it has already achieved a size that is already usually in a stage 3 or 4. So doctors right now would advise screening procedures.
Define screening?
Annual test that has at the moment proven not effective.
Really?
In terms of reducing the morbidity and mortality of these patients.
But parang, I mean, we're all advised, especially those who are predisposed. Let's say, for me, my father passed away due to prostate cancer, and doctors already telling me I should have myself screened for prostate screening. And so you're telling me that this approach does not work, is not working.
Usually that's a problem. If a family member is or has been diagnosed with cancer, they would recommend cancer screening for all the family members.
Yes.
But as I've said, most of the families now have a member of their family with cancer. So they would usually recommend a lot of these screening procedures. But studies have shown, even in the American Journal of Medicine, that the PSA or the prostate screening test hasn't really reduced the morbidity and mortality. There's another study conducted for ovarian cancer wherein those who underwent regular screening even had higher mortality rate than those who did not have.
Wow.
So
why is that?
What is actually increasing, you're increasing the risk of undergoing chemotherapy, radiation, than decreasing your risk of mortality.
And other invasive procedures, biopsies. Now, Hans, what is wrong with these invasive, these Western, traditional, conventional diagnostic tools for cancer?
Well, some of them were created in order to create a new term for a cancer. I mean, let's say about the mammogram. Because of the mammogram, you have this ductal carcinoma in situ, which is basically identifying a benign mass as being a culprit. And then you're going to subject it to a lot of pressure, ionizing radiation. Then finally, you're going to poke at it.
Yes.
And then what was just an innocent lump, which normally is just a manifestation of something being wrong. It's not really a cancer yet.
Yes, it's something that's wrong with your system, with your body, yes.
Now you put the pressure, the trauma, and then you put the radiation, then you poked at it, then all of a sudden it's in the lymph nodes already, it starts to spread, and then it's in the blood, then it spreads throughout the body. So what we're saying is that there are other methods of doing this. Remove the radiation, the ionizing radiation. The World Health Organization has classified it as a class 1 carcinogen.
Yeah.
Can you imagine? A class 1 carcinogen, and we're applying it to ourselves 1,000 times more powerful than an X-ray.
Yes.
And then you subject the patient to that every year.
Yes,
They're
yes.
saying over 40 years old. There are other ways to do that. There are non-invasive, non-radiation, like let's say thermograms. Because when inflammation is there, it means that there's something wrong. So a thermogram will detect, let's say, different, what you call is a temperature in certain parts of the body, especially the breast. Then you can now start paying attention. And in fact, a thermogram or a sonogram can be 3 years now predictive. In BioSafe,
Okay.
they're able to predict
Okay.
predisposition 3 years. This is your
Prior.
year.
No, so what you gentlemen are saying is that you guys don't believe in what Western medical doctors say, that the orders they give to people with illnesses like this, that you get a biopsy, you get and all these tests and invasive techniques. You are against this totally.
I am against biopsy. I am against surgery. Personally, sir, I have 3 sisters who have breast mass. 2 of them here. I'm doing alternative treatment. They're still okay. We play badminton. We go out. I have a sister based in Canada. She was diagnosed on a Friday. She was operated on a Monday, the following Monday. She had chemotherapy. Right now, she's very weak. She had several fractures already because of the side effect of the chemotherapy. So when I was talking to her, it's okay, it's free. It's free, but you're destroying your body.
Yeah.
So that's the problem. That's the problem. So I'm biased against surgery and biopsy.
But doctors will argue by saying that if we don't chemo this, if we don't radiation this, the cancer cells will be there, they won't die, we have to kill them, we have to do surgery to remove the cancer. What do you have to say about that?
You kill the cancer cells, but these cells are the ones that are already mutated. Before you can start to even weaken them, we would be already weakening the other normal cells. So in that process, you will be weakening the whole body. So you will be prone to other illnesses, which may shorten your lifespan and be lethal. So you may die because of the complications of chemotherapy than the cancer, which is the primary problem.
So, Dr. Nora, if a person, if some cancer patients are watching us now, you would advise them not to do any of these things, not to do any biopsies, not to do any radiation, not to do any chemotherapy. That would be your advice. Let's say if someone watching here would call you and say, Dr. Nora, I have this condition. Okay, what would you recommend? What would you advise this patient to do or not to do?
There would be other modalities that we could do, so we could check if we really have cancer. As Hans have mentioned, some harmless lump, when subjected to all of this radiation and trauma, may really mutate. So by the time you get a diagnosis, it's already cancer.
Have you seen cases? Have you seen cases like this where you know what they thought was cancerous turned out to be benign after all?
There's I think it's going out now in the American Journal of Oncology, wherein they subjected 78,000 women, and of these 78,000, half were subjected to regular screening, half were not subjected. And
what kind of screening for?
For ovarian cancer.
Okay.
And those who were subjected really had a higher mortality than those who were not subjected. And in this half that were subjective, there were 3,000 plus who had false positive tests. So they were subjected to surgery, radiation.
And it turned out to be
useless.
Not needed in the first place.
Not needed in the first place.
Let's talk about ovarian cancer screening. What goes on? Just so I will know and our viewers will know. How does one screen for ovarian cancer? Is it invasive? Does this require a biopsy of some sort?
Problem with ovarian cancer, it's in the middle of your abdomen.
Okay.
So before you feel the symptoms, it may already have been, it may be already too large.
Okay.
So the problems you usually have would be bleeding,
Yeah.
or compression symptoms wherein you feel full.
Okay.
So you usually, the doctor would usually suggest an ultrasound.
Yeah.
And the best way for an ultrasound would be transvaginal,
Yes.
or transrectal for those who are still not married.
Okay.
So it's invasive and painful. And after that, they usually would suggest biopsy
Yes.
to know what kind of chemotherapy.
So what you're saying is that more than half of these 78,000 women who underwent this conventional step-by-step screening method for ovarian cancer, more than half of them end up developing cancer. According to the study.
They had a higher incidence of developing
They had a
cancer
higher incidence of developing cancer
than those who did not.
Who didn't go through the test. Amazing. Hans, you mentioned in the past show something, a term called poison or burn, or is it?
Cut,
did I get
poison,
it right?
and burn.
Cut, poison, and burn. Please define what this means.
Well, the cutting is the operating, the poisoning is the chemotherapy, and the burning is the radiation. It's been a formula that has been used for the last 100 years. And then billions of dollars for cancer research are just poured into that. I mean, you know, there has to be some solution. They're already cloning people. They're already doing GMO babies and all that. And they can't cure cancer. We've sent people to the moon. There is a big money component to this. So the cut, poison, and burn is where the money is. See?
Absolutely.
So if you have, let's say in the U.S., if 70 million people who get cancer and they pay $150 for for a certain test, how many billions of dollars will be lost if they don't use that particular test. That's what it's really big money. So the cat poison burn doesn't work. As I said before, the definition of insanity is doing something over and over again and expecting a different result.
Yes.
And it's 100 years already been doing that.
Dr. Nora, why is it that the medical profession still continues on these traditional approaches when obviously, as Hans said, you do something over and over and expect a different result? It's insane. So what is wrong with the medical profession or
It's controlled
industry?
by the big business. It's what's being taught to these young doctors nowadays. So, if you have cancer, yeah, cut slash
Poison and burn.
poison and burn.
Poison and burn.
So that is really what's just being taught. So young doctors who just have this indoctrinated in their mind. So this is what they do. So this is what they're going to promote to their patients.
That's all they know.
Oh, so it's like that, thinking outside of the box. There are other alternative methods that would actually improve your quality of life. I'm not saying we would be able to cure all the cancer cells, but we'll be able to improve your quality of life. So you'll still be able to enjoy your life. Even if it's just 3-4 years to live, those 4 years would be meaningful instead of undergoing chemo. You know, there's a study made in the U.S. Those who have liver cancer, who underwent chemotherapy, had 3 to 6 months prognosis. Those who had liver cancer and just did exercise, they actually live 8 months. Longer than those who had no chemotherapy, but they live longer just doing exercise.
So it makes you wonder, why do chemotherapy
Why do chemotherapy?
in the first
It's
place?
very expensive.
Yes,
It's
yes.
very painful.
Yes.
But
And I can relate because my father, as I mentioned, he passed away 2 years ago prostate cancer, and he did everything: radiation, chemo, hormone therapy. He did food, the cryosurgery, everything. And I could really see how his condition deteriorated. Really, I mean, like it was inevitable. And so, looking back in hindsight, I would have probably advised him not, just not to have done any of that. And it didn't save his life. It didn't extend his life. So I can definitely relate. Now, we have to pause for a break very soon and talk about BioSafe Center for Complementary Medicine. But quickly, in the BioSafe Center for Complementary Medicine, you guys treat cancer patients here, and you have had success stories.
majority of patients right now are cancer patients. Right?
And how good would you say your batting average is? That's it.
Better than chemo, sir.
2 out of 3.
It's
More or less.
More or less 2 out of 3.
So that's we're talking about 65-70% almost. That's pretty good odds. I would gamble on those odds any day of the week. So, Dr. Nora, thank you very much. We have to pause for break, Hans, but we'll be back. Guys, we'll be back after a few minutes with more of a fighting back against cancer when Philippines Uncut returns. We featured Dr. Benavidio Castro and his Dorn method, his gentle spinal manipulation, and his practice of helping a lot of people with cancer. Today, our discussion continues on alternative remedies, and our guest tonight is Mr. Dr. Ernest Francis G. Nora. He is a psychiatrist, an MD, and an integrative medicine specialist. And joining him is, again, an alumni of Philippines Uncut many times over, Hans Palacios, natural health advocate. Welcome, gentlemen, to Philippines Uncut. Good evening.
Good evening.
Thank you very much for coming on the show. Now, Hans, let's start with you briefly. Tell the viewers about your work as a natural health advocate.
Yes, I'd like to basically spread the news.
Good evening, ladies and gentlemen. Welcome to Philippines Uncut. I'm your host, Buddy Kunana. Now, on this show, we talk about everything under the sun, and tonight's topic is about health and wellness. Now, you know, folks, here in Philippines Uncut, we have made the anti-cancer campaign an advocacy of sorts. You can call it a crusade, as we seek to increase awareness to as many people as possible about this dreaded illness, the possible causes, and possible remedies, focusing, of course, on alternative methods. Now, where Western conventional medical science has failed or seems to have failed, we hope to bridge this gap through our discussions on alternative treatments. Now, last month,
Be advised, the opinions and views of the hosts and guests do not reflect those of the station.